At Kois Dentistry, we specialize in transformational dentistry, whether it be a denture or a full mouth reconstruction. Number one, we always focus on the patient. Every treatment plan is different, whether you're doing restorations on teeth or you're building restorations on dental implants with patients that have no teeth. When I mention the term transformational dentistry, it's really giving a patient what they've always wanted in their smile. For some patients, it's 2 front teeth. For others, it's a full complement of teeth. We actually have several modalities to restore a patient's dentition if they're already missing their teeth. So once we place the dental implants, the patient has a couple of options. One option is to create custom ceramic bridges on the implants, similar to what you would have on your natural teeth. Another option is the all-on-4 restoration. It's a restoration that includes all of the teeth as well as some of the gingiva, the pink part, the gums. Many patients that have been missing their teeth for a long time require the replacement of some of that tissue as well. So we have the ability to do both restorations. In terms of restoring teeth, typically we have options of veneers, which are for patients that typically have all of their teeth, but they're maybe undersized or chipped or broken or worn, and they also maybe aren't the desired color for a patient. So veneers are partial coverage restorations that could restore all of those things, brighten the color, restore shape or enhance shape to give a patient the smile of their dreams. We also do restorations on teeth that are more sick. We do a lot of restorations on patients that have worn many of their teeth or have broken many of their teeth. So we also do full arch restorations with crowns and bridges. Either option, you're hopefully getting a smile that exceeds your expectations here at Kois Dentistry. Our process for smile designs and transformational dentistry is first getting to know the patient, understanding their objectives, and being honest and really opening a dialogue about our ability to execute their desires. That includes a patient interview, that includes photography, special 3D scanning, and maybe even historical photographs, because sometimes we're recreating a smile a patient once had, and other times we're creating a smile a patient's never had. So we typically use a lot of digital technology to really enhance and reinforce our communication. We then would move to a smile design try-in. So the product of our discussion and what you'd like to see in your smile, we're typically able to try that in right over your existing teeth to ensure that we're communicating well and what you're asking for is going to exceed your own expectations. Once we both are aligned, then we move forward with doing the dentistry. If you're interested in replacing any of your missing teeth, the time is now. Technology's never been better, and there's no reason to wait because the dental implant option for you can only restore health and wellness.